Good morning, everybody. Today we are going to talk about women's health and diabetes. All right. So we have amazing guest coming, Melissa, who is an educator as well as advocate for the diabetes community. So before we start, thank you so much. Thank you for coming back, Bear Nutrition. Appreciate it. So before we start, let me introduce myself. Hi, Mel. Welcome. So I am going to women's health and wellness practitioner and certified nutrition counselor. And hi, Mel.
Hey,
Welcome. Thank you
hey
so much
Chu.
for being here. Sorry, it was a technical glitch earlier. We couldn't hear couldn't hear about the volume didn't work. All
All
right.
good, all good.
Oh, we have already question here. Just hang in. Just okay. What was I saying? And yeah, of course, I'm the founder of this platform. And today we have amazing Mel here. So, what is Bear Nutrition asking? Do you have any advice for postgraduate courses or education for diabetes as a nutritionist? So, is that yours? Before we start, just wanted to let you know that this talk is all about educational and awareness purposes. So if you need specific, help, then please go and seek for help to your practitioner, or you can always connect with Mel directly. So Mel, did you want to answer the question, or
Yeah,
is that
hot
on
off the
your,
press question first up.
yeah,
That's
so,
that's okay. Yeah, so there's lots of unis around Australia that do postgrad courses, so graduate certificate in diabetes education. So I guess depending on where you are, you can search up your local uni. So if you're a dietitian, or there's a few different primary disciplines that you can have to do the study. So I would suggest yeah, look up your local uni and yeah, see what courses there are available around. Otherwise, there's lots of uni courses or certificates that do online training as well for the graduate certificate in diabetes education.
awesome. Thank you. I hope that answered your question. So, oh, actually, we haven't even read your bio. How rude of me. That's very rude. So, let me, read beautiful Mel's bio. And so she is clinical nurse specialist and credentialed diabetes educator. And she has been working for past 20 years in hospital, community-based, uh, FIFO or FIFO. How do you say it?
I think it's FIFO or fly in, fly out. I used to do.
Fly
I used
out.
to hop on a
And
little plane and go to remote communities. Yeah.
yeah, sounds like a dream. Yeah, to the remote areas roles, including indigenous health areas of clinical skills, adults and pediatric and diabetes care, including type 1 and type 2 diabetes management, diabetes and pregnancy management, and insulin pump therapy and continuous glucose monitoring technology management, cancer care, and diabetes management. Other areas of clinical skills, clinical teaching at Southern Cross University, Gold Coast, diabetes and medical trauma counseling with Centre Therapy Trauma Informed Practitioner. So hello, everybody. Thank you so much for being here. And you are located, your private practice that you're working at is located in Nerang,
Yeah.
Queensland. And we will put all the details that the website and then, contact details in the content below for everybody. And as much as you are amazing professional registered practitioner, you are mom of two little people who keep her busy and is really enjoying her second season in with the Surface Paradise Masters AFL team this year.
Yeah.
I feel so excited when you posted that photo when you did the AFL. I was like,
Oh,
you
yeah.
go, girl, you smash it.
Right out of my comfort zone. But no, it's been awesome. Yeah, it's been
Yeah,
great.
that's awesome. So that's amazing. So yeah, okay. Let's start with our first question. What inspired you to become a advocate for diabetes community?
So I think my primary discipline is nursing. So in the first few years of my nursing, I was, yeah, just obviously supporting lots of people in the inpatient setting. People with chronic diseases were coming into hospital a lot, whether it was from a complication or from a diagnosis point of view. So I think that health literacy for people was really lacking. So I think if I didn't do nursing, I would have done teaching. So diabetes education is sort of a mixture of both. So
Mm,
I've got that health background where I can support people with regards to their health or disabilities, and then teach people about that and how to manage it as best as they can. So
mm,
just that knowledge, that gap that people had, I just love to teach and share my knowledge with people and help people manage something that is sometimes, yeah, 24 hours a day, 7 days a week, no break. So
mm.
that's what inspired me, the people that I used to look after as a
Yeah.
very young nurse 20 years ago.
Yeah, no, that would be, when you understand and when you have someone teaching you about your condition, I think you'll be much easier to handle, right?
Yeah, I think that knowledge is power. So
Mm,
when we are not sure about something, it's very difficult to navigate. So something as complex as, say, type 1 diabetes,
yeah,
if you know as much as you can try and look after it as best as you can to, yeah, just live well and healthy and happy.
yes,
Yeah.
yeah, that's beautiful. And so, what are the types of diabetes? Because we know there are a few different types of diabetes, and in a, can you define it in a very basic way so us people, general people, can understand, you make the sense of it.
Yeah, it is tricky to explain. I usually do some interpretive dancing and lots of drawings, but if you think about when we eat a carbohydrate food, for example, that's our energy
Hmm.
food that breaks
Yeah.
down into glucose and that goes into
Hmm.
our tummy. We need to get that across into the bloodstream and then across into the muscles where it's stored as energy. So insulin is made in the pancreas, so
Hmm.
that is the hormone that helps that whole process happen. So diabetes is when there's a bit too much glucose or sugar
Mm.
floating around in the blood because the pancreas is not able to make
Not
any
working.
insulin or not enough. So then there's a few different types of diabetes that we can look at and have a chat about, but basically it's just the body's not able to get that energy from the blood into the muscles where we need it. So type 1 diabetes is an autoimmune condition. People don't do anything to cause type 1 diabetes. There are lots
Mm.
of theories around as viral, environmental, genetics for some people as well. So that's where the pancreas just stops making insulin. It is where people need to have insulin to survive. So
Mm.
that can be 4, 5, 6, 8 injections a day
Oh,
to manage
wow.
that. Some
Mm.
people are fortunate enough to be having access to insulin pumps.
Mm.
So that is another way that we can manage that. Type 2 diabetes is where the pancreas is not, it's still making insulin, but just not enough. So some of that extra glucose is trapped in the blood. So people can look after that with moving their body, eating healthy,
Mm.
regular meals, and it is progressive. It's a bit trickier to look after the longer that you have it. So we
Mm.
want to keep an eye on all of those things that we can look after with blood tests. We keep our feet in check, our eyes checked, and things like that. That complication, that annual cycle of care for all
Mm.
diabetes, not just type 2 diabetes, I should add. But it's progressive, so it's a bit trickier to look after the longer that you have
Yes.
it. So people can progress onto tablets, and then maybe a couple more tablets, and
Yeah.
then some non-insulin injectables, and then one day insulin. So
Yeah.
type 2 is where you're still making it, but just not enough, but you need
Yeah.
help over the years.
So type
Gestational
1,
diabetes. Oh, sorry.
yeah, sorry to interrupt. So
That's
type
okay.
1 doesn't progress, only type
You're
2?
just not making any insulin at all, so you need
Yeah,
insulin for
so you
life.
have to
Yeah.
rely on it constantly. But with the type
Yeah.
2, it's like it progresses. So you have to, okay, can you slow down the progress or not?
So the big studies show that moving your body, good food, all of those things can delay that progression most definitely.
Mm.
Yeah. But
Yeah.
as we age, we go grey or we might need glasses, I say to
Yes.
people that sometimes our pancreas just gets a bit tired and it tries really hard to make
Mm.
that insulin, but over time people can progress through those treatments. So it's certainly not a failure if people have type 2 diabetes and they might need to go on a tablet after a few years and then
Mm.
another one a few years later. It's just that progression, that aging process that we can't do much about. But the big studies, as I said, show that moving your body, good food, regular meals can, slow down that progression.
Yeah.
Yeah.
That's amazing.
Gestational diabetes is another type of diabetes that you might have heard about. So that's diabetes in pregnancy. So
Yes.
that's purely just hormone related. So the placenta is amazing at helping baby grow and develop, but it can cause some insulin resistance. So if a mama is pregnant and has some insulin resistance there, she will have one of those lovely GTT drinks around 24, 28 weeks
Oh,
of
yes. I remember
gestation.
that drink. I
Some
remember
people
the
like
drink.
it, but yeah, not all other
It
people
was
do.
too sweet. Yeah, but you have to do what you have to do, right?
You do, yeah. So that's how we can screen for it. There are some other ways. That this is a really changing space at the moment because the screening for gestational diabetes is just changing very recently via ADIPS, the Australian Diabetes in Pregnancy Society. So that's a nice space to watch at the moment. But gestational diabetes goes away when mama has baby because the baby's delivered, the placenta's delivered, all that insulin resistance drops off. So mum's not needing to make as much insulin as she would have. So yeah, that goes away. But women with gestational diabetes are at more risk of type 2 diabetes in the future. So
In the
it's really
future.
important for us to screen for that every couple of years if you do have a history of that gestational diabetes as well. There are a couple of other types of diabetes that one's called MODY and another called LADA. That's they're quite complex. MODY is quite complex, and even after 20 years of nursing and diabetes, I still find it difficult to explain. But it's a big genetic metabolic type diabetes, insulin
Oh,
resistance.
okay. Yeah.
And LADA is another name sort of for slow onset type 1 diabetes. So it's really tricky for people that sometimes might be diagnosed with type 2 diabetes, but then they progress through the tablets and the insulin very quickly. And then it might be that they've tried everything, they're doing amazing, looking after themselves, but they're just needing more and more medication very quickly. And it is that slow onset type 1 diabetes. Type 1 diabetes can occur at any age.
Yeah.
But we tend to see type 2 diabetes sort of in our 30 plus range. But then again, when I was in the territory, we were seeing really, really young people, 11, 12-year-olds developing type 2
Oh, wow.
diabetes. So
Yeah.
diabetes is changing. It's been changing over the years. The way we look after it, the way we manage it, the way we screen for it, it's all changing. So
Yeah.
it's just really important for people to have that knowledge and awareness.
Yeah. It's becoming, I've been looking at the, research, and it's getting huge, bigger and bigger issue. So I think if we keep talking about it, bringing awareness, I think we can help to at least, bring the awareness and how we can manage it.
Yeah,
So,
definitely. So I
yeah.
think about when I started diabetes a long time ago, it was around about 200 people were being diagnosed a day. And I looked recently and I think it's up to about 323 people per day. So I think it's
Oh,
one
wow.
person every 5 minutes is being diagnosed with diabetes.
Wow.
So and for every person that's diagnosed, there's often someone that has diabetes but might not have those symptoms. So it's really important just to have those regular blood tests
Yeah.
with the GP or your healthcare team just to screen for that, particularly if you've got a family history of type 2 diabetes in
Yeah.
particular. Yeah.
So, Bear Nutrition is asking, can a diabetes educator consult with patients?
Do you mean like, I'm not sure what you mean by that. So you can see people and teach people about diabetes. So as myself, I get
Consult
referrals
means,
from,
yeah, consult
yeah, so
like
I
as,
get referrals from GPs, endocrinologists. I have people that want to just come and see me without any referrals who just want to learn about diabetes. So yeah, that's that people can access diabetes educators through their GP, through an EPC or a care plan that you might have heard of. So yeah, there's lots of different ways that people can access diabetes educators. Yeah.
yeah, yeah. So, I wanted to ask, so what are I think different diabetes would have different symptoms. Is that correct?
So I guess any hypoglycemia or high blood glucose levels with all of the different types of diabetes are quite similar. So if you've got if you're not making enough insulin, whether it's type 1 or type 2 diabetes or gestational diabetes, the body will usually let you know that you've got those high levels. So lots of people will get very thirsty. They'll wee
Mm,
lots. They'll be very tired. Some people can get a bit cranky. Some people's vision changes, so the lens of the eye will change shape, and then that will change vision.
Mm.
Uh, those are the most common symptoms. So weeing a lot, thirsty, tired, lethargic,
Mm.
and pins and needles. But then again, some people don't have any symptoms at all, particularly with type
Yeah.
2 diabetes. Type 1 diabetes is a very sudden onset. So people with who develop type 1 diabetes, it's very sudden, very quick, and they can
Mm.
become quite ill very quickly, but
Mm.
get better straight away with fluids and glucose and insulin and
Yeah.
medication. Yeah.
Wow. It's incredible, isn't it? That yeah. There's another question. Thoughts on the link between PCOS, how do you say it, and insulin
Poly
resistance?
polycystic ovarian syndrome. Yeah.
Yeah.
So yeah, we see in my clinical experience, I've seen lots of women
Mm.
who will have a history of PCOS and that insulin resistance. So some ladies might start metformin. That's a really great
Mm.
tablet for diabetes, type 2 diabetes, or women who have PCOS. So that helps with that insulin resistance. So the muscles can become more sensitive to the insulin that lady is making. So the glucose levels can be impacted that way. So there
Mm.
is you are at an increased risk with diabetes with PCOS, but lots
PCOS.
of everyone's different. Diabetes is very individualized, so that's why it's
Mm.
important to link in with your healthcare team and keep track of those
Yeah.
your own medical history to look at what you
Yeah.
can and can't be at a higher risk of. Yeah.
Mm. Yeah. So it's because we're all different, and every I think disease or everything affects you in a different way, isn't it? In the, like individually.
Yeah.
Yeah.
Yeah. Yeah. It can
So
be genetics, lifestyle, behavior, lots of
mm,
different things can impact it.
yeah.
Yeah.
So the among the different types of diabetes, which one affects women the most? I think it's a no-brainer, but I just want yes.
So yeah, diabetes, it doesn't discriminate.
Yeah.
So it's pretty. I think males are slightly more impacted, like stats wise, but
Mm.
women are impacted. Yeah, women can develop type 1 diabetes, type 2 diabetes, gestational diabetes through pregnancy as well. So yeah, women are impacted that way. The other thing I probably want to comment on is that for every person that has diabetes, there's often a caring type role in that around that person. So I see
Mm.
lots of little people that have type 1 diabetes, for example, and mum and dad are impacted, sisters and brothers are impacted by that diabetes, school teachers are impacted by that diabetes.
Mm.
Whether it's directly or indirectly, there's a lot of people impacted by diabetes. So
Yes.
it's yeah, as I said, it doesn't discriminate, but yeah,
Mm.
women with gestational diabetes definitely have to do a lot more through that pregnancy to look after the glucose levels. And
Yes.
even people with type 1 diabetes or type 2 diabetes with that pre-pregnancy planning, that's a really important time to
Mm.
be looking after the glucose levels and making sure that you're as well as you can be to conceive and have a good pregnancy as well. So yeah, I think everyone's affected, but we're all sort of affected in different ways. Yeah.
Yes, yes. Now, this morning, Tia, she is advocate for type 1 diabetes community, and
Mm.
she sent me video, and she was, so I was wondering how would that affect type 1 diabetes women with the, if they want to become, fall pregnant and things like that. So, yeah.
Yeah, so it's just a bit of extra planning
Mm.
preconception. Yeah,
So,
so just
yeah.
making sure glucose levels are okay, that women are monitoring, having their medication, that the complication screening is up to date. So yeah, there's just a few extra things to do prior to looking to become pregnant.
Yeah, so she was showing us the little gadget that she puts on, and she flipped it at the back. It looks like, the back of the when you look at inside the when you open the, iPad or any mechanical thing, it
Yeah.
looks like wowzers, what is that? And it's in a tiny little pot, so it
Yeah,
gives
the
the
Omnipod. Yeah, the
I think
Omnipod
so.
patch
I
pump.
can't remember
Yeah.
what pot it was that she's using, but
Yeah,
she
it sounds
showed
like the
us.
Omnipod.
Yeah, yeah. So,
Yeah.
yeah, she was using that, and the technology is amazing, isn't it?
It is, it's changing rapidly. Like it's as a diabetes educator, we have to be across all the different types of diabetes and
Mm.
then all the medications and then there's the tech. So there's even in the last, probably since March, I think the Omnipod came out around in March, but since
Mm.
probably March to now, there's been a couple of new sensors released. There's some new
Yeah.
features with the other insulin pumps where you can do boluses via your phone, via an app.
Yes.
There's a couple of different sensors talk to the Omnipod, for example. So there's a lot to keep up with when you're supporting people with diabetes. But in
Yes.
saying that, there's an amazing community of people out there with type 1 diabetes, for example, who are, it's amazing to see everyone support everyone and just teach other people that don't know about diabetes what it
Yes.
is, how we look after it. They're two
Mm.
very different conditions, say type 1 and type 2 diabetes. So yeah, I think any education for anyone is very valuable. That health literacy,
Mm.
back to that again. Yeah.
Yeah, people around you, and so they can not take care of you, but sort of when you understand better, you know, then you empathize and you don't judge the person because because you sometimes you think, oh, you're just low in sugar, so what's the fuss, right?
Yeah.
Or high
Yep.
in sugar, because in your mind you don't think it's that complicated, and
Yeah.
it can be
Yeah.
life-threatening, right? Is
It
that
can be,
correct?
yeah. So, for example, if you've got type 1 diabetes and you don't have insulin for a day or two, you can become very ill very quickly. In
Mm,
saying that, if you've got type 2 diabetes, and you can become very sick very quickly as well, depending on what other comorbidities, health conditions that you might have. But yeah,
mm,
when I see people, I talk a lot about that sick day management because, any underlying illness on top of diabetes can be very very serious, and it's very
mm,
impactful. That it's Diabetes is a condition that it doesn't go away, it's invisible, and I think it's very easy for people to judge and possibly not know,
mm.
or make comments that might be a bit inappropriate, because people with diabetes are making a lot more decisions every day. It's actually
Yes.
diabetes week this week, so I'm hopeful that people have seen lots of information out there on social media about diabetes this week. But it's something that is invisible for type 1 diabetes. There's no days off. There's
Mm,
there's there's 180 extra
yes.
decisions 180 extra
Yeah.
decisions per day that people with type 1 diabetes, for example, have to make. So it's
Mm,
it's every 5 minutes that they've got to think, well, what's my blood sugar? What am I going to eat? How
mm,
many grams of carbs are in this? Where's my insulin? Did I do this before? Have I done this? Where's
mm.
my needles? Things like that. So there's a lot to consider. And then, as I said before, there's a lot more people are impacted by that as well without
Mm.
diabetes. So yeah, I
Because
think
it's
knowledge
a
is power. Yeah.
yes, yeah. Thank you. Thank you for that, Mel. And yeah, the I just want to. I would love to talk to you for hours, but we are a little bit, with the time wise. So, what is your final advice to people who are caring, and as well as for the people who are going through diabetes?
Um, I don't think I could narrow it down to one piece of advice. Maybe that you're just not alone. There's beautiful communities out there, whether it's on social media, local, through your healthcare team. So I think, as I've said a few times, I think knowledge is power. So when you're ready
Yes.
to learn about it, it will become a little easier. And there's no days off. There's good days, there's bad days, but you're not alone. So no matter what type of diabetes you have, you're
Mm.
not alone. And just to reach out, that emotional health is really important with a chronic disease as well. So yeah, I think you're not alone. Uh,
Yeah.
Reach out to your team, and don't be don't be shy. Yeah,
Mm.
when
Yeah.
you're
I think,
ready, reach out.
yeah, when you educate yourself, you can support better and you can look after yourself better. And I guess it gives you less panicky moment as well, right? Because you know what to do and how to do and how to support. And yeah, and that's when
That's
you
right.
come.
Yeah.
That's when you do amazing job, Mel. Well done. And so let us know where people can find you, as we already
So
spoke, I think, a little bit, but yeah,
yeah, I'm just in Narang at Connections,
yeah.
so I can see anyone with diabetes, as you said, type 1, type 2 diabetes, insulin pump therapy, I do some medical trauma counselling with little people as well through the sand tray therapy role that I have as well. So yeah, reach out,
Yeah. And
jump on the
can
page
people
anywhere.
reach out? Yeah, reach out to you on the website, and can they message you in the social media as well?
Yeah, sure. Yep,
Yeah,
definitely. Any
yeah,
whichever platform, and yeah, we'll
yeah.
go from there.
Awesome. Thank you, Mel. Thank you so much for being here. And I think this is our second year. We have done it a few times, I think.
Yeah, we have.
This
Yeah,
year.
Diabetes Week. It's
Yeah,
yeah,
Diabetes Week.
it's a big week.
Yeah, yeah,
Thanks for
yeah.
having me. Thanks for
No,
asking. Thanks.
thank you. Thank you for being here, and thank you for your time. And as always, you always, speak very loud about the education is a power. So thank you so much, and we believe that too. Thank you,
Thank you.
Mel.
Thanks,
You have a
Anne.
great
Thanks, everybody.
day.
You too.
Bye.
See ya.
Thank you,
Bye.
everyone.
See ya.
Thank you so much for being here. Bye.